Hi everyone, welcome back to Global Academy of Medical Education. In this session, you're going to learn about a very important topic from general pharmacology, that is drug potency and drug efficacy. Myself Dr. Padmanabha TS, Pharmacology faculty at Global Academy of Medical Education. So let us move on to learn what is drug potency and drug efficacy. So in your exams, this is the most commonly asked topic you should not miss at all. So first we'll take the drug potency, drug potency. So let us draw a dose response curve. So this will be a representation of the response versus the dose, log dose. So if we plot a graph like this, so this is the y-axis and this is the x-axis. So x-axis represent the log dose, whereas the y-axis will going to represents your response. On the x-axis, let us write the dose which has to be administered. So this will be the 0 dose, this will be the 2 milligram, this will be your 4 milligram, this will be your 6 milligram, 8, 10, 12, etc. And this will be your 50% of the response, and this will be your 100% of the response, So dose is comparable to the potency. Please remember, dose means we are talking about the potency. So potency is related with the dose. So if we think of the relationship between the dose and the potency, it is inversely proportional. So let us draw dose is inversely proportional to potency. So let us see what happens if you increase the dose and if you decrease the dose. So let us draw a DRC for a drug A that will be administered. So this is your drug A. So this is drug A. And let us draw a graph of drug B also. So this is your drug B. So whatever the dose you are taking on the x-axis, please remember, we are talking in terms of the amount of drug we are administering is comparable to the potency, whereas on the y-axis we're going to measure the response is nothing but the efficacy. So here you can see, let us draw the effective concentration for both drug A and the drug B. So this will be your effective concentration for drug A, and this will be your effective concentration for drug B. So let us assume, so this will be the 8 here, 8. So let us assume this is the effective concentration at 50%, effective concentration of 50% for drug A and drug B. So if you want to get a response similar to that of drug A, so drug B dose has to be increased. So to produce the effect, the dose required by drug B is more compared to the drug A. So as we said, the y-axis will going to measure the efficacy. Efficacy is nothing but the height. Efficacy is nothing but the height of the curve. So among the drug A and drug B, so are there any differences with respect to the response obtained? So the height of both drug A and the B. So the height of drug A and B are same. So the height is same. So that means the efficacy is same. So efficacy of drug A and drug B is same, but to produce the same response to that of drug A, drug B dose has to be increased. So see here, this is the dose which you need to increase. This is the dose which you need to increase. So this is called the potency. So if we calculate it, so see, the dose of drug A is 4 milligrams, whereas the dose of drug B is 8 milligrams. To produce the same efficacy, so drug A you are giving 4 milligrams and drug B you are giving 8 milligrams. So what was the formula we arrived in the beginning? The dose is inversely proportional to the potency. That means if the dose increases, so please remember, if the dose increases, what happens to the potency? Potency will decrease. So there will be decrease in the potency. If the dose is reduced, so what will happen to the potency? Potency will increase. So potency of the drug will increase. In other words, what you can see, the drug A is more potent. Drug A is more potent than drug B. So please remember, so this is your x-axis. If the drug concentration moves towards the right hand side, what happens to the potency? The potency will decrease. So if the dose moves towards the left hand side, what happens to the potency? If it moves towards left hand side, the dose required is less, so thereby potency will increase. So these are the things you should remember with respect to the drug potency. So next, let us understand the drug efficacy. So what do you understand by drug efficacy? Drug efficacy. So please remember, again we need to draw a plot graph DRC to understand it. So this is your y-axis and this is your x-axis. As we know that the x-axis will tell you about the potency. It is nothing but the log dose, where the y-axis will tell you about the response is nothing but the efficacy. So now let us plot the graph for drug A and drug B to understand the concept of drug efficacy. So see here, so this is the drug A, this is your drug A, and next is your drug B. So what we said, on the x-axis you determine the potency. So let us say this is your 2 milligrams, 4, 8, 10, and this is your 50% of the response, 50% of the response. So please remember what is the potency of drug A and drug B. So if you take a potency of drug A and B are same, they are equal, so it is 2 milligrams. So what is happening to the efficacy? So what we learnt in the previous slide, efficacy is nothing but the height. It is the efficacy is nothing but the height of drug. That means the response what you will get when you administer a drug. So here what will be the efficacy? So drug A and drug B. So the height of drug A is more. See that this is the height of drug A, whereas the height of drug B is here. So the efficacy has been decreased for drug B. So the height is less. That means to say drug A is more efficacious than drug B. So the efficacious is nothing but it tells you about the Vmax. So Vmax for drug A is better than compared to the Vmax of the drug B. So this has to be kept in mind. So in other words, if you generalize it, if the response moves upwards, what will happen to the efficacy? The efficacy will increase. If it moves downwards, what will happen to the efficacy? Efficacy will decrease. So this is the concept of drug efficacy. In your exams, they can give a dose response curve and they will ask you to choose the right statement regarding drug A and drug B. So if you are thorough with this concept, definitely I will assure that you will get one question from this concept in every exams. So please be thorough with this concept. So just to summarize it again, so please remember the drug potency. So drug potency, if you draw a graph, so this is the drug A and drug B. So they have got similar efficacy, similar height. So drug A and drug B efficacy is same, whereas to produce the same height for drug B, the dose has to be increased. To produce the same response to that of drug A, the dose of drug B has to be increased. The dose of drug A which is required to produce the response is 4 milligram, whereas the dose of drug B which is required to produce similar response to that of the drug A is the 8 milligrams. So if the dose moves towards right side, what happens? The dose will increase. As we know, the dose is inversely proportional to the potency. If the dose moves towards right side, the potency will reduce. If the dose moves towards the left side, that means the dose required is the less. That means the potency will increase. So the dose of drug A is 4 milligram, dose of drug B is 8 milligram. So if you increase the dose, the potency will decrease. If you decrease the dose, potency will increase. So here in this graph, drug A is more potent than the drug B. So what does the potency will tell you about? So please remember, potency will tell you about the amount of drug which is required. It is the amount of drug needed to produce the response. It is the amount of drug which is needed to produce the response. So please remember, it is the amount of drug which is needed to produce the response. So whereas the efficacy, as you can see, efficacy, so you're going to measure the height of the drug. So here the height of drug A is more than height of drug B, That means the efficacy of drug A is more. That means Vmax of the drug A is more than drug B. So as the height increases, the efficacy will increase, and as the height decreases, the efficacy will decrease. So what does the efficacy will tell you about? Efficacy is the maximum response. It is the maximum response to the administered drug. It is the maximum response to the administered drug. So this was about the session on drug potency and efficacy. So hope this will be helpful for your upcoming exams. Thank you.